people are using one hand, as you see in these screenshots from a YouTube video called Choking Girls in Public. Sometimes, not nearly as often, but sometimes people will describe using two hands. Sometimes they describe using an arm around the neck, or a leg around the neck, or a ligature, like a tie, a cord, or a belt. In our research, we found that the ligature is pretty rare and that mostly it's one hand. In our interviews, people tell us it's usually one hand and that two hands can be seen as aggressive. Some people may like two hands, but that more often seems to be something people feel like should be talked about before it's done. So there are different styles of choking. Because this involves external pressure to the neck that may close off air passages and or blood vessels, it is technically strangulation, right? So any external pressure to the neck that's restricting blood flow or airflow technically is what strangulation is, whereas choking is technically a blockage of the internal airway, like when we worry about people choking on food or toys. However, the fact is that people who engage in this sexual practice tend to describe it as choking. They often tell us in interviews that when we ask them about the word strangulation and words they may have heard or used, they say that the word strangle or strangulation feels like crime or violence or aggression or really an intent to harm somebody, whereas choking is what they think of as more associated with sexual exploration or intimacy or or kink. And so we have found that, at least with college student surveys, that some of them are intending to restrict only blood flow, and they're trying to do that by pressing just on the sides of the neck. Some are intending to restrict only airflow and maybe focusing their pressure on the front of the neck. But about 1/3 say they're not really sure what they're doing when they engage in choking. They don't really know if it's blood flow, airflow, or both. They also report various intensities. So we've given them, a subjective rating scale of 1 to 10, with 1 being very light and 10 being very hard or intense. And they use the whole scale, right? They might say, well, typically I'm probably at a 4, but sometimes I've been choked at like an 8 or 9. Some people have choked me very lightly too, around a 1 or 2. So people will use the whole scale. And this is important because sometimes people say, oh, when you hear about people choking, they're not really choking. Like, this isn't strangulation. It's really very light. And we say, actually, people give us data that conflicts with that, and it's all over the place. And it might be, and I think it is the case, that there are some people who tend to go very, very light. They don't want to be choked hard. They don't want to choke their partner hard. So those people do exist, and there probably are people whose choking does not meet the definition of strangulation, but we would see that most people it does. And so, but again, they're going to use the word choking. And this choking is also the term that you'll see if you looked on popular pornography websites, in mainstream media magazines and their websites like Cosmo Men's Health, Glamour, Women's Health, and so on. And it's also depicted in a lot of TV shows and celebrity interviews and all sorts of things. So some people say, well, especially younger people younger than 40 are like, well, I mean, why is there so much attention to this now? Like, it's just always been popular, right? And they're kind of surprised when I say, no, actually it hasn't been. I've been in this field for 25 years. We like never really heard much about it. Not that we didn't know it existed. Of course, different kinds of strangulation and sex have been happening for, at least they're like recorded for hundreds of years. Mainly, if you go back 300 or 400 years ago, mainly they were documented when things went wrong, when there were accidental deaths, for example, in brothels where people would sometimes specialize in, you could go to a brothel and pay a sex worker to be present while you hung yourself as kind of your safety so that you hopefully didn't die. Sometimes people did die anyway, and then it would be in the newspaper. So, the idea of this as a sexual practice is not new, but the idea of it being prevalent is new. So we don't have a lot of data on this because it really was generally considered very, very rare. Here's a couple data points that we have. One is from the early 2000s when some colleagues in New York led a study where they surveyed people at 2 LGBTQ events in New York City. And they found that 5% of lesbian and bisexual women and 8% of gay and bisexual men reported that ever in their lives they had engaged in any kind of asphyxiation or breath play. So they didn't ask about choking specifically. Choking would have just been one subset of this broader umbrella term. But again, that means it would have even been lower than these figures of 5 and 8%. Then in 2011 and 12, Anna Bridges and her team conducted a study that was focused on young people and pornography use. And about 88% of their 1,600 respondents were college students. They restricted the sample to heterosexual people only for this one paper. And they reported that 13% of women and 9% of men reported that they had ever been choked with hands by a partner. That was 2011 to 12. Then our team came along, and again in this 2020 study right before the pandemic, January, February, and we found that of 5,000 randomly sampled undergraduate students, when we looked at the 90% of students who had ever so much as kissed or sexually touched anyone or been kissed or touched, that 64% of women, 29% of men, and 56 of trans and non-binary students reported that they had ever been choked during sexual activities. Most of this was consensual. We have continued to follow this since 2020. We have done 4 campus representative surveys, again, random samples of students. And we can, every single wave, we find these very high numbers of students reporting that they've ever been choked. We now differentiate between consensual and non-consensual. And as you can see, the non-consensual rates are sizable, with 18% of women, 7% of men, and 11% of trans and non-binary students reporting that they've been choked without consent. So these are high numbers of young people reporting that this has happened to them. So who is most often on the receiving end of being choked? Certainly, young adults are most often engaging it, but women are most often on the receiving end, as well as trans non-binary students or young people. Sexual orientation minorities, but specifically bisexual women, bisexual men, and gay men are more likely than heterosexual people and lesbians to report that they have been choked, although rates are high across the board, much higher than those 2 earlier studies. As just a couple examples, don't focus too much on the individual numbers, but let's look at the pattern. So this is a pattern that we can see by age, where if we just take the women who we know are generally choked more often, and we look at their most recent sexual event, and this is in a U.S. nationally representative survey of more than 3,000 adults, and we found that 35% of the 18 to 24-year-old women were choked just the most recent time that they had sex, and compared to less than 1% of women who are 60 and over. And so you can see that this is very, very common among young adults. And you can also see a pattern where they're not very often the ones doing the choking to a partner. So they're much more often receiving it. Looking at a pattern by age and gender, we see again from another U.S. nationally representative survey, if we look at the sort of orangey red as women and the blue as men, we did have trans and non-binary folks in the study, but the numbers were so small we can't sort of parcel them out by age here. But you can see this real difference with age, where women are far more often the ones reporting being choked, and also young adults are far more so than adults in their 50s and older. Now, for several years, we were the only team publishing work on choking, which led some community workers and clinicians in other countries were feeling really challenged because they were seeing this happening in their clinics. Their students were asking about them, but when they would go, to their supervisors to try to get permission for education or funding for programs, they would be told that's just an American thing, right? Like that it's not really happening here, or it's not happening in big numbers. So they had to start going in and collecting their own data, right? And it's been phenomenal to see these data roll in, and also really striking to see how closely they align with what we see here. And again, these we think are like largely media influenced behaviors, and so they are happening to anywhere where young people are looking at similar media. So there's actually 2 studies out now from Italy from 2 different research teams showing high rates among young adults and also more among sexual orientation minorities than heterosexual folks. The Australian College college student data align almost exactly with our college student data, showing very high numbers, again, with around 2/3 of women reporting that they've ever been choked. And the data from Iceland also showed that age pattern where you see very high numbers of young adults who have engaged in choking. And in their study, nobody age 55 and older reported having ever engaged in choking. So it's important to know that in addition to becoming a lot more prevalent with many, many more young people reporting that they're engaging in choking, even just since 2020, since our 2020 survey, we now find that more of them are reporting being choked at high frequencies. So several years ago, we'd had far fewer, I think it was around a third or quarter to a third that had been choked more than 5 times. And now it's like 3/4 that have been choked more than 5 times. And really strikingly, in our most recent campus sexual health survey, which is what CSHS stands for, it's one of our campus representative surveys of thousands of college students, we found that 22% of them had been choked 25 or more times. So this is a lot of impact on the body and specifically the brain, which we'll talk about in a little bit. So it's prevalent, it's frequent, and because these are young people, right, we also have to engage with the reality that there's some portion of these people who may be pregnant as well, which may have implications for for the health of their developing baby. And so we have found in one of our nationally representative surveys when we ask about, if they're having periods or if they're pregnant or things like that, and where they are along in their pregnancy, if they are pregnant. And then in another part of the survey, we're asking about their sexual behavior. When we analyze the data, we're able to find that about 15% of the pregnant people in our study report that they were choked during their most recent sexual event while they were pregnant. So that, again, like they're limiting oxygen supply throughout their body into their brain during pregnancy. And so we really need to be focusing some attention on that as well. So when is this starting? I mean, for some people, it does start in adulthood, but we are seeing for the people who are young adults right now that they often report first engaging in choking as teenagers. And so in that 2020 survey, we found that 1 in 4 college students who had ever been choked reported that they were first choked between ages 12 and 17. 56% had first been choked by age 18. In our most recent campus survey in 2023, we found that 36% of them said that who had ever been choked were first choked by age 17 and 62% by age 18. So it's becoming more prevalent, more frequent, and it's starting younger. So why do they engage in it? Well, again, it's not always a choice for all of them. About 1/5 who say that they've been choked say that they've never been asked for consent or if it was okay before being choked. Another third say that sometimes they've been asked for consent or if it was okay, but sometimes not. Generally, their reasons are that it seemed exciting or kinky or adventurous. Less often do they say it's about arousal or orgasm. That surprised us because certainly for autoerotic asphyxiation, when people are hanging themselves, for example, during masturbation, the idea has always been that it's been more about arousal and as part of the arousal and orgasm experience. But it seems to be more about identity, about like, this is what you do. It seems exciting. This is how you become a sexual person. And there is a small subset that in interviews tells us that they are intentionally suppressing their oxygen to feel euphoric effects or bursts of energy when they get their oxygen back. So that is some subset that seems to really enjoy like the breath play aspect of it. They are learning about choking from all sorts of sources, from friends, partners, pornography, and diverse forms of media. These are some examples of TikTok videos. There's a lot of these sort of first-person experiences, mostly by young women who describe why they like being choked. But even fitness influencers, like this guy on the bottom, is talking about how to choke people the quote-unquote right way. And it had, racked up all kinds of likes, even just in the first few weeks of being out there. But choking is referenced in a lot of very popular media among young people or shown in some popular media. So in shows like Euphoria, which was very popular among teens when it came out, More recently, The Idol is a popular show among teens. It features Lily Rose Depp and The Weeknd, who are very popular actors and performers among young people. Most of these are pretty positive depictions about choking. Law and Order is one of the few. Just this past year, it came out with an episode that showed that it can be risky to health and can even kill people. The song Loving on Me by Jack Harlow was the #1 song in the country at the end of 2023, beginning of 2024, for 6 non-consecutive weeks. So when it wasn't #1, it was often #2 or 3. It was like always up there for months. And one of the taglines of the song is, I'm vanilla baby, I'll choke you, but I ain't no killer baby. And so it's positioning choking not only as mainstream, but as vanilla. And that YouTube video had been viewed hundreds of millions of times, by the way. So it's very, very popular among teenagers and young adults. When we interviewed people, we also had several young women, when we would ask them how they learned about choking, they would say the memes. And we went to go find out what memes they were seeing, and we found easily hundreds of memes about choking. We analyzed as part of a paper that we published called #ChokeMeDaddy, a content analysis of memes related to choking or strangulation during sex. And we use that hashtag because that is the hashtag that we commonly use to find these. And so #ChokeMeDaddy is still out there. There are newer memes all the time. We were curious kind of what sense of choking people would get if they were to stumble upon these. So for example, on the left, you see when you made him angry earlier, just so he can choke you with both hands during sex. Or with Kermit, girls who like to be choked, tied up, and slapped during sex are also the ones who cry when you yell at them. So we found a whole group that kind of seemed to position girls and women almost as confusing for, not wanting a certain type of violence, even though they liked being choked or slapped or other kinds of rough sex. Or some that seem to minimize potential harm, like when the choking went a bit too far, but you're happy she opened her eyes again. There was another one that was used a lot that featured the cartoon character Arthur digging in the backyard, like sort of a reference to, to a partner accidentally dying from being choked. And then this one on the right that really mocks the idea of consent. She said choking during sex without consent is assault, and just as laughter by men. So we thought that these were really important, to understand, because these are the messages, right? Memes are used to be funny. They're used to kind of bring up a point, but they're not used usually to teach information. And indeed, we hardly found any that kind of addressed actual fact-based information about choking. But we generally found the sense that they were positioning choking as kind of erotic and romantic, even in some cases. And then again, like women and girls are confusing, and that minimized harm. We did another study where we wanted to find what it is that people would learn about choking if they were going online and Googling. And indeed, we found that there was a lot of misinformation out there. We found that there were 27 articles that came up in everything from the Chicago Tribune to WebMD to Women's Health, that none of the articles indicated that choking was a form of strangulation. Most described it in positive terms like hot, sexy, pleasurable, or adventurous. And although about 70% of these articles acknowledged that in rare cases people could die, fewer of them addressed other things that could happen, like brain injury or cardiac arrest or non-fatal injuries, or that health outcomes could even be delayed by days. Most suggested that there was a safe or a proper way to choke. So they might say something like, now you have to be careful of this because people can die, but like, we've got you covered, right? We're going to teach you the safe way to choke. So as long as you do it like you read here, you're fine. And they would also tell people to communicate or to get consent, but usually without any detail. And this is really important, I think, for anybody working on college campuses, as I am, and many of you are, because one of the things we found is that they would say things like, make sure you get consent first, but nothing more. And where we've seen a lot of things go wrong is actually sometimes both people were interested in choking. Both people were fine with being choking. They were texting about it, they were messaging about it. They say, yeah, like I did ask the person to choke me, but I am used to being choked really lightly, and I was not expecting them to choke me so hard. Like that was so scary. It really made me feel like they were trying to kill me, right? So there's no information in these these articles about how to negotiate limits or boundaries like you would expect if you were having like more detailed conversations in a kink or a BDSM community about any type of higher risk practice, or really any type of play that you're doing together, is where are people's limits and boundaries. So we didn't really see that information in the articles to help people navigate this if indeed they decided to engage in it. We have continued to see other kinds of misinformation too. So again, these articles would talk about like how to choke safely, and they usually would just say that you've got to, apply pressure to the side, to the carotid arteries, not acknowledging that that is still dangerous to the body, that you can have a carotid dissection, that you can have a stroke. Although those things may happen rarely, they do happen. And so we have also seen even sex educators, popular sex educators, have information where they do provide warnings. I mean, this particular educator provided a lot of warnings about engaging in sexual choking or strangulation, but also still provides, I think, probably unwittingly, some misinformation. So, for example, here telling people to not like hold, the press, but to sort of pulse it. And on the one hand, it is true that like pulsing it is going to be less likely to kill you because sustained pressure, if you can't breathe, can kill somebody. But at the same time, what is not shared here in this video is that the pulsing may affect the brain. It may be repetitive stress on the brain. And that is something that most people wouldn't know. I know that because I have a colleague who's a neuroscientist who, when we were hearing from people that they were doing this pulsing and this repetitive, this sort of back and forth and sort of choking and then releasing and choking and releasing and choking and releasing. I mean, he just said that's repetitive stress. Like this is, not a good idea for people to do. But I think most of us wouldn't know that, right? And so there's another example here in the bottom where again somebody's talking about using this pulsing pressure. And so there are a number of articles and videos that talk about that, and that may be where young people are getting that as well. So we also heard from people who just learned about it just from having it done to them. Like I was hooking up with someone and they like kind of did it and like asked if I liked it or something, and like that's the first time that I had like done it, and then after that I was just kind of into it. So a lot of things just happened. The first one, she would actively encourage me to choke her, like this, he's referring to his ex-girlfriend. Like she would get immense pleasure out of that. So that's when I kind of got hooked onto it, maybe. And then the next one, luckily, doesn't really mind, from this 19-year-old straight man. So in a new study that just came out from our team a few months ago, we looked at like the different ways that people learn about it. The women are in red, the men are in yellow, the blue reflects trans and non-binary students' responses. And so you'll see that pornography is overwhelmingly for men and less so for trans and non-binary folks, where they report first learning about choking. But Friends is a really big one, especially for women and trans and non-binary folks. And although social media is lower than things like pornography and Friends, when it's endorsed, it's much more often endorsed by women, by twice as many women as compared to men. And women and trans and non-binary students also overwhelmingly report erotic stories. And this can be erotica like books that are often talked about on TikTok, for example. But also when in our interviews, we find out it's very often erotic fan fiction that they've been reading since they were 11, 12, 13 years old, 14 years old. So pretty young ages to be learning about choking and rough sex. We've also found that in that same study that most of them, about 89%, agreed or strongly agreed that people could die from being choked during sex, so they expressed some awareness about that. But half of them felt that they knew how to engage in choking safely. And those who had learned the most about choking from other people, from friends, partners, were more often viewed choking as something that they could do safely. It was a safe practice, whereas those who had learned the most from media viewed verbal consent, safe gestures, and being sober as important. So there seems to be some relationship between where you're really learning about choking and how you perceive it. Now, we've got to talk about health here because, I've mentioned it a few times, it's really important. So when I started becoming aware that my students were engaging this in high numbers and I recognized choking as technically a form of strangulation, there's a vast literature on the negative health effects of strangulation. So when I would mention this to students, or even to colleagues, people would say, well, I mean, that's different, right? Like that's domestic violence, strangulation, like that's like someone's really trying to hurt somebody. That wouldn't have the same effects on, on the person's body. But, your brain and your carotid arteries don't know whether it's consensual or non-consensual. And the reality is that, as many of you will know, not all interpersonal violence, strangulation, is very hard or aggressive. Sometimes it's very light because the intent is to threaten somebody or to let them know that you could hurt them. So it's not all really hard. And the same is true again for sexual choking. Sexual choking, some of it's very light, some of it's very hard. A lot of it is in the middle. On average, people give us about a rating of 4 on a scale of 1 to 10. But again, they use the whole 1 to 10. And that's true in research on intimate partner violence and strangulation. Some people report really low levels, some people report really high levels, and a lot of it's in between. So there are some similarities and there's some differences. Certainly in violence, people are trying to threaten or harm, and in consensual sex, they are, presumably trying to provide pleasure, to do what their partner wants them to do what maybe they think they're expected to do sexually, but it's not going to be about harm and violence. But even in interpersonal violence, people are not, fortunately, usually strangled that many times. And studies of the health effects of being strangled repeatedly often means 2 or 4 or 5 or maybe 10 times. Certainly some people have been strangled more times than that for sure. But the research is overwhelmingly these multiple strangulation events are pretty small in comparison to what we see with our college students, who, again, 1/5 of them have been choked during sex 25 times or more. So this may be a real, added layered stress on their brain because it's happening over and over and over again. So since people kept telling us, aren't these different? Really, like choking can't possibly be bad for you. So we said, well, let's find out what people say, right? We always go back to the research. So I don't expect you to see these tiny little words. I'm going to point out a few in the coming slides. I'm going to draw a few out that I want you to pay attention to. I'm showing you this long list only to show you that we asked about a lot of things, right? When we thought, okay, well, if we want to know what the impact is on people's bodies and what they experience, we need kind of an inventory list. And so there wasn't a great one available to us. There were some that SANES or SARTs use in their exams. It's more like a clinical examination and things they're looking for. There are some that happened in interviews with people who have experienced strangulation. There's some that people use in emergency rooms. There's some that, have been in research. And so we took kind of all of those, and we also took what we were hearing in our interviews from people we talked with when we would ask like what they noticed in their bodies, and we made a long list. And then we put this into a survey. And some that I want to draw your attention to are that around 40% of these college students and grad students reported that when they had been choked during sex, they had had experiences where they couldn't breathe or couldn't speak, which not only has implications for their health, but also for consent and their ability to withdraw consent. Around 19% had experienced neck pain and 2% involuntary loss of urine, which speaks usually to the duration of time that they've been choked or strangled. And also, a lot of them have experienced euphoric sensations, which are not surprising because, again, this is a practice that is decreasing oxygen. And then many people report feeling like a burst of energy or like happiness or euphoria when they get that oxygen back. And that euphoric response is long documented in the research on neck compression or strangulation. We also found people who reported blurred vision, temporary vision loss, or like tunnel vision, feeling dizzy or lightheaded, like they might pass out, or actually having lost consciousness. Now, if you take any one of these, we found that 19% of college and undergrad and grad students report at least one of these. And so 1 out of 5 who had been choked, that's a pretty sizable number. And these are grouped as what's called alterations in consciousness. So in the intimate partner violence literature on strangulation, there is research led by Eva Lara out of Harvard. It's excellent research on strangulation and brain injury. And again, she's focused on partner violence. But she has said, for a long time, people were just focusing on loss of consciousness. And she tried to get people to move to say, it's not just loss of consciousness, right? There's this thing that happens like right before you would lose consciousness. And some people don't fully lose consciousness, but they have these other things where like they're getting close, and that is an effect on their brain. And we should be paying attention to that effect on their brain. And indeed, what she has shown is that people who have experienced these alterations in consciousness from being strangled as part of intimate partner violence are much more likely over the long term to have poor mental health and to have poor neurocognitive function. So she has really been a leader in looking at, again, the impacts of strangulation on the brain and on brain health. So we wanted to see how many of our college students and grad students were experiencing these AICs, or alterations in consciousness. And again, 1 out of 5. So that's sizable. We also looked at the different kinds of responses they've noticed in the hours or days after being choked during sex. Again, their neck continuing to hurt, 1 out of 5, neck bruising, 1 out of 6, a sore throat, their voice sounding different, like hoarse or raspy, so 11% of them, ringing in the ears, headaches. So we're seeing like neurological symptoms here. Memory loss is 5%. So our loss of consciousness rate is usually around 3 to 4%. But one of the things I've learned from the Training Institute on Strangulation Prevention medical team is to not just ask about loss of consciousness, since obviously some people aren't going to remember that, but to ask about memory loss, which is a pretty good surrogate because you also pick up the people who just don't remember that they've lost consciousness. And indeed, when we ask that, we pick up just a little bit more people, going from 3 to 4% to 5%. So that is like a probable brain injury right there, if you have lost consciousness. And then 4% report neck swelling. So for those of you who are familiar with strangulation or any like neck trauma, you will know that if you have neck swelling, that is generally considered as potentially life-threatening, meaning that it should be observed that if the person has difficulty breathing or they have neck swelling, they need to be going to the emergency room. They might be fine. The swelling might go down. There might be no impact internally, or they might have an airway collapse and they could die. And so, this happens with any type of neck trauma, that they just say, like, observe a person, and if they have neck swelling, like, get help. So when we think about even some of the messages we could be giving young people who decide to engage in this, even if they know the risks, one of the things I now tell my students is like, if you notice neck swelling, like, please seek medical help, right? So we can give them some harm reduction messages. So here's my wonderful colleague, Kei Kawada's work. As I mentioned earlier, he's a neuroscientist. He has spent a lot of his career to date studying subconcussive head injuries in soccer players and football players. He's incredibly smart and creative. And I went to him during the pandemic and I said, Kei, I'm doing all this work on choking. I know you don't do sex-related research, but you're so smart about the brain. And I suspect that just like other kinds of strangulation, that this kind has an effect on the brain, but I don't know how to do that, right? You do. Would you have any interest in doing this with me? And he went back to his grad students, and he has quite a few young women, grad students on the team and undergrad research assistants. And they all said, yes, this is important. And this is like happening and for people our ages, let's do this. And so he has been an incredible collaborator for the past few years, and his research assistants as well. And they led this pilot study several years ago where we found, women who had been choked and choked 4 more times in the past month, women who had never been choked, and using blood biomarkers, so blood samples where they looked for biomarkers, and also putting them in the brain scanner and doing scans of their brain while doing different tasks. They documented pretty robust differences between the brains of women who had been choked 4 more times versus those never choked. So we have 4 papers out about this now. If you're interested in this, I encourage you to read them. He explains it much more, much better than I do, not being a neuroscientist. But let me tell you a couple of the findings that really speak to me. One of them is that, again, you have all these like college and grad students, right? So they're pretty capable, right? They're able to go to class. They're able to engage in high level education. So they're certainly able to get things done. So it was not a big surprise to them that both groups of women were able to do the verbal and visual working memory tasks. that they were assigned to do or asked to do as part of the study. But here was the difference. Because they were doing these verbal and visual working memory tasks while their brains were being scanned, what Kay and his team were able to see is that for the women who were being choked, who had been choked 4 or more times in the past month, that their brains had to work harder to arrive at the correct answers. So as he describes it, this is evidence of their brains being less efficient in some way. There's some other work where they look at the what's called the gyrification of the brain, where we think of all those folds and stuff. And I learned this from him because I didn't know really anything about gyrification before. And from what I understand, right, these folds, one of the really nice things about them is that when they kind of get close to each other, then like the messages don't have to travel far, right? Because like you can have this really efficient, nicely working brain, and the natural side effect, if you will, or a natural experience of aging is that we all sort of lose some gyrification as we age. Well, what they saw is that in these young, healthy college and graduate student women, that the women who had been choked 4 or more times in the past month had less gyrification than the women who had never been choked in their lives. So potentially looking at like that their brains may be aging more rapidly as well than women who had never been choked. So this was a preliminary study. They are doing more research now. We are trying to get funding to do much bigger research. But these are some preliminary evidence and some of the other findings they list here as well related to connectivity and cortical thickness that suggests we need to have a closer look at brain health. Now, as I've mentioned, it's rare. It is rare that people die from being choked during consensual sex, but it does happen. And there are, court cases around the world. There's no systematic reporting of this. So, unfortunately, those of us working in the space don't know how common or rare it is. But we do see some cases. This summer, the young woman in the bottom, her accidental death got a lot of attention in the United Kingdom from very big media because this was a couple that certainly their friends and family were aware that they engaged in what they considered to be a pretty adventurous sex life, included that did involve choking. So the people around them were aware of that. And according to her boyfriend, it was an accidental death, and he was really distraught about this and went to the hospital. They were unable to save her, and then he killed himself as well. For the other ones, men have been, charged with their deaths, and they have gone to prison for having accidentally killed their partners. So these are rare cases, but they happen. And my own college students, when I a lot of attention. They were it happened to be around that time that the court case was happening, and my college men particularly said, you need to be telling your students about this because we didn't know that like we could get in trouble for this, like that we didn't know we could go to jail. And what they shared with me was that there had been, they just felt like as long as something was consensual, that they would not be responsible for somebody's accidental injury or death. Now, while one might hope that they would just be moved by the accidental injury or death itself, the possibility of legal consequences really stuck out for them, and it was what they urged me to tell other people in the future. So we'll get back to that in a little bit, and how that did affect some of our future work. So what I want to share with you here, though, is that as I've mentioned with like the breathing and the inability to speak, that choking poses really unique challenges to consent as compared to something like intercourse, right? If 40% of them can't breathe or speak, then we have real challenges for consent or telling people like this, this hurts, stop, I don't like this anymore, it's too hard. And again, 19 to 30% are reporting alterations in consciousness, which not only have implications for their brain health over the long term, but it also may mean that if you're kind of feeling like you might pass out, you might not be able to use the safe words or safe gestures that you've agreed on with people. And certainly if you pass out, you can't. So that has come up in some sexual assault cases where people say, we did agree on safe words, but I couldn't use them. I didn't like how I was feeling, but I couldn't use them. So we've also found that many of our college and grad students and even beyond college just don't discuss choking before engaging it. They often assume it's something that people generally like or want to do, and so they just generally choke without really talking about it. They may take their partner's hands and put it on their own neck as a non-verbal cue, like choke me. And we hear this from people of all genders. So if people decide to engage in choking, even knowing the physical risks, it is a high risk activity. So we do encourage people to talk about it first when they're not having sex and not using substances, and to really discuss those limits and boundaries. So if people do decide to agree on choking together, we do say you might want to talk about like intensity. You might want to talk about if it's one hand or two hands or a ligature, because we have interviewed people who are used to being choked by hands, and then maybe they're in the middle of sex and they are like on their hands and knees, and somebody suddenly puts a belt around their neck. No discussion, no warning, and it just happens. So we really encourage much more clear conversation. Now, here's something I don't have good answers to, but I really want to raise with people doing education in this topic. So in some of our interviews, we noticed a pattern. This was a paper that we published a couple months ago that's focused on our interviews and the sections of the interviews that talk about communication and consent. And several people, again, of multiple genders, brought this up. So this is a man who's 29, and he says, he's talking about some of the partners. He says, some of them have grabbed my hand in a way that, yes, like they like it, or sometimes it's like enough, or as I said, the tap. So people will like tap out, sort of like tapping a hand, like tap, tap, like stop. And people just are supposed to interpret that as like either done or lighten up. And that also can get confusing to people. But he said, after a couple of encounters, I've learned like, okay, can I keep going? I don't know how long it is. And others, it's actually like, no, just you've learned their body and their response. It can be there all day. Some of them, get red and a little blushed and feel like they need air. And that's when I stop. And then she tells me, oh, no, no, keep going. So it's hard to tell just from looking at that. It seems like you're struggling. Let me help you. I'll take my hand off. They're like, no, what are you doing? So that's hard to figure out, like the right length. So I think the tap is a good one. So here he's describing that he prefers when partners tap to let him know when to stop choking them, because otherwise he has gone by like if they're turning too red and he worries, he doesn't want to hurt them. So he releases his hand so they can breathe. But then he's had partners be like, no, 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 what are you doing? Like, keep choking me like that. Like, why are you stopping now? So we have had that. We've had women also talk about like their partners stopping too early and they want them to keep going. And we've heard men really not knowing what to do. So this feels to me as a sex educator and researcher like a really complicated space to be in for anybody, but let alone teenagers and young adults who are pretty new to sex, right? And now they have to figure out like, is this possibly going into dangerous space or not? And how do I know? And how do I tell from looking at somebody? And how would you even know as the person, right? You can have different levels of response to low oxygen, and some people are very alert and some people aren't. We have a member of our team who studies hypoxia. So that's one of the concerns he has, are people sort of thinking maybe that only a non-responsive person would have low levels of oxygen. But as he points out, you can actually, some people are very highly responsive, and some people are not. And they can, you can't necessarily tell if somebody's oxygen level is higher or not based on how they're talking to you. We've also found that being choked can seems to be associated with a risk for poor mental health. So in studies, we found that young adults who have been choked during sex are significantly more likely to report feeling depressed, sad, lonely, and for women, overwhelming anxiety. Now, this is an association. We don't know the directionality. It could be that people who are already feeling depressed or sad or lonely want the euphoric effects from being choked. It also could be that, similar to the partner violence literature, and the effect on the brain is that it has an effect on the brain that results in poor mental health. Or it could be both. One of the challenges is that being choked is not the same across genders. So what we find is that women and trans and non-binary students who are choked often report being choked more often than cisgender heterosexual men at greater intensities and with that repetitive style, right? That sort of pressure on, pressure off, pressure on, pressure off, which is more of a stress to the brain. Men who report choking are more often choked just like a single choke rather than a repetitive style. All right, so this is a lot of information that you've gotten. We've talked about how that choking is prevalent, that it presents risks to health, including the potential risk of death or things like stroke. But it's also considered these days very mainstream and almost vanilla. So now what do we do about that? So in talking with young people, I do try to share fact-based information about the risks, but I try not to use a fear-based approach. I do share that there are many other safer ways to be intimate with a partner and to explore their sexuality alone or with partners in exciting ways. Um, we can consider approaches that focus on brain health rather than sexual health. I teach human sexuality, so I can easily focus on sexual health. Some people don't teach about sex. They may not be able to talk about sex in some places, but there are a lot of schools focusing on brain health. And we can always remind people that the brain needs oxygen, the brain needs blood flow. Don't do anything to the brain that takes away its oxygen and blood flow, right? So there may be ways to get at this and other ways for people who aren't able to talk about sex or don't feel comfortable to do that. And for people who do choose to engage in various forms of rough sex, including choking, we need to encourage explicit conversations about clear, unambiguous consent, discussions of limits, boundaries, and intensities, and harm reduction approaches where possible. And to err on the side of safety and gentleness also where possible. So I think there are different, right? There's different types of things that we can target. Some of them are about the prevention of health risks. Some of them are about the prevention of assault. And when we're trying to prevent assault and non-consensual choking, really focusing on the consent messages can be key. So many adults are understandably, I think, uncomfortable talking about choking and rough sex. I say understandably because these things just weren't really prevalent when a lot of people in their 45 and above were 18 and 20 years old. So it's just newer, right, to people, and newer things can be understandably uncomfortable. But because these are so much a part of young people's social landscapes and their media landscapes and their sexual situations, we really do need to step into these conversations to support them in getting non-judgmental, non-shaming, accurate information. In one of our studies with 973 randomly sampled college students, we found that they were 15 years old on average when they first learned about choking. Women and men were 15, trans and non-binary students were 14 on average when they first learned about choking. These college students felt that information about choking and its risks should first be given to young people in middle school, 1/5 of them thought. In high school, 61% of thought. And 6% of them thought starting in college was fine. Very few of them felt that you should just never be talking with young people about choking. So they recognize it as something that is very common around, themselves, their friends, their partners, and it should be talked about. So where do these 973 undergraduate students think that we should be talking with college students about choking and health? So focusing now just on the college environment. So we get that most of them think it should start in middle school or high school, but for those of us working in college environments, how do we do this? So one of the things that I thought was really exciting and affirming was that they really want this information and they really want it from people on their college campuses. So they liked the idea of including videos that address choking and its risks and sexual assault prevention programs. 78% of them endorsed that. Also, campus-wide health education media campaigns. 72% of them liked the idea of sex education workshops in residence halls addressing choking. 82% one-on-one conversations with healthcare providers, 82% college-level general health courses, and 87% for sexuality courses like the one I teach. Videos on the Student Health Center website, 70%. First aid courses, 71%. So like those are all really high numbers. Like any of these could be great. And probably we can do more than one of them, right? You can put some videos on a website. You can train some faculty to teach about it too. Have some videos in a sexual assault prevention program and reach lots and lots of students. 60%, not near the high for the others, but still more than half of students said that social media and peer sexual health led programs were also good options. So and celebrities like are not who they trust. So they are not on this slide, but celebrities got like really low ratings. But overwhelmingly, again, they want college health folks, college healthcare providers, college faculty teaching sexuality courses, college counselors. So, it makes some sense, right? And maybe some of this will be unique to our campus. We have like a huge history of sex research and education. So I think all communities and campuses need to test out their own stuff. But at the same time, what we saw was like, we're a huge campus, but they generally are trusting us to give them good information. They trust the counselors in our Student Health Center website. They trust the doctors and nurses there. Those of us who are teaching health and sexuality related classes, and peer sexual health educators as well. So all of these are really good options forward. Now, we don't need to focus on all the specifics. I just want to give you an example of something that we did, and we have a paper under review right now about this. So you're the first group I'm sharing these details with. We created 5 messages. These are just 3 examples. I would totally do different messages today if I were to do this. I would hopefully do better ones. But this was a good start. This study was done in 2021, and we just had a lot of other projects, so it took us some time to get the data out. But basically, we had 1,000 students in this. We randomized them into 3 groups. They either got all 5 of our messages, which were about consent related to choking, legal consequences of accidentally injuring or killing somebody during choking, and the health risks of choking, or they got just the consent and health messages, so not the legal ones, or they got no messages at all about choking. And so just as an example, the consent one is like in a 2020 survey, 21% of college students who had been choked during sex said that they had never been asked for consent to be choked. Just because a person has consented to hook up or have sex does not mean that they've consented to be choked. Choking a person without clear consent may be considered sexual misconduct. We also had about the legal consequences. Nearly half of college students have been choked during sexual activities. However, even when choking during sex is consensual, if a person is accidentally hurt or killed from being choked, the person who choked them may be held legally and criminally responsible for their injury or death. That one was inspired by the college men in my class who were like, you need to be telling men about this. We don't know this. And again, some health examples that were generally related to brain health and mental health and so on. So again, we randomized these. All of the 5 messages that we tested were well received. They got high ratings of like being feasible to share with college students, acceptable by college students, and they overwhelmingly indicated that these were new information. This was new information for them. We also had good preliminary evidence of efficacy, and that the college students who saw these messages, whether the all message group or the consent and health only group, were significantly less likely to report that they were likely to engage in choking or to be choked in the next 6 months. That was like later on in the survey, we asked that again. But what was really interesting, though, was for the men. I mean, my students were right, and I'm glad I listened to them because, like, they know their lives better than I do. And for the men, it was really the legal consequences that made the biggest differences. So although the health and consent messages moved the needle a little bit for some men, it was group A that also had the legal consequence messages, that those were the ones who were really significantly moved to say that they were less likely to choke somebody within the next 6 months. So that did seem to connect with them. And again, men are more likely doing the choking and less often on the receiving end of choking. So some implications. First, college students do want to learn about choking, health, and consent. So this is very positive and affirming for me. Like they want us to talk about these things with them. Also, they place a lot of trust in college health professionals of all sorts, nurses, doctors, counselors, faculty, so, and peer health educators as well. So we can support people in learning about diverse sexual practices, but we also need to make sure that the presenters are reputable in providing medically accurate information. So we can be skeptical of workshops that claim to teach safe choking. They're out there. There's a lot of them. And I know college faculty who unfortunately, had somebody coming in to talk about like rough sex or kink or things more generally or like sexual diversity. And then we're really surprised to see somebody talking about like safe strangulation or safe choking. So the idea of pressing on just the sides is not actually a safe form of choking. It may be that people are a lot less likely to immediately die, like that's true, but that's not usually what they say when they teach it. They just say it's safe. And that's not the same thing. So we also need to pay attention to language. I regularly get emails from people asking about this. And, I get that a lot of people have an investment in wanting to make sure that people understand that choking is a form of strangulation in most cases. I totally get that. Because again, we've interviewed more than 90 people about this term. They don't use the word strangulation. So always check in with the people that you connect with, that you're educating. I still do tell people it's a form of strangulation when I teach, but I don't stay with that. As you've probably noticed in this talk, I use the term choking most of the time because if I were to tell my students, hey, don't strangle each other, they would say, we're not strangling each other, right? Like I would never strangle somebody, but they're choking. And so it really feels meaningfully different and it can feel stigmatizing to at least the people I've spoken with to use the word strangulation. So I educate them on the difference. I acknowledge that choking is the term that is commonly used, and then I move forward. And so I will say that like, in our messages, we got good feedback on, again, like their feasibility, acceptability. One thing that we did hear though is that they would have liked more statistics. Like we had just a little bit, I thought of students as maybe not wanting too many statistics. They said include more statistics, like give us some footnotes, cite the sources. For things like brain health, they didn't understand how it was that like being choked could lead to poorer brain health. So they said it would be nice to have a few more sentences on this. So we will continue to work on developing messages. I know that you all are continuing to work on that too. So just sharing some of that feedback in case it's helpful. They kind of want to understand the how of that. And there is a lot of information on the strangulation literature on the how. And in case my colleague Kate Kawada's work, he talks about mechanisms too. All right, so clinical care implications. For people who are nurses and doctors, we can consider anticipatory guidance. So things like, you might have heard about choking during sex. It's in a lot of media these days, and there's a lot of misinformation about it. I want to make sure you have some accurate information, right? We could be doing brochures in waiting rooms. We could have posters, but you could just say this. Again, the majority of college students, more than 80, thought one-on-one conversations with healthcare providers was something that they thought was important and that they were open to. For some mental health care providers, some of my colleagues, I've suggested that they broaden their intake to not just asking about assault, although that's really important, but also asking something like, has anyone ever done something rough to you during sex, like choked, slapped, or smothered, that you either did not consent to or that you consented to, but it was rougher than you expected? So in one of our studies that's under review right now, we found that people who have these non-consensual rough sex elements, even if they're during otherwise consensual sex, are reporting sort of mental health challenges on the same level as people who've experienced like just sort of more traditional forms of sexual assault. So in other words, like this can rattle people, right? We hear this from people, like everything was going fine and then they started like slapping me and choking me and it got really scary and I didn't know like if they were trying to hurt me or not. So we need to be thinking about that type of non-consensual elements to people's sexual encounters. And I also have some colleagues who study brain injury around the country who, for lots of reasons, have been trying to urge clinicians to more regularly screen for all sorts of brain injury. One of the things that I have students ask me about is like, hey, like, yeah, I engage in choking. I've been choked for like months or years or whatever. And yeah, I do have a lot of sensitivity to light and I do have a lot of headaches. And could I have done this to myself by like, asking to be choked so much? And I always say, right, first of all, I'm not a nurse or doctor. But I'm like, it could be, right, from being choked, or it could be from maybe a sports related thing or some other thing, some other health issue. Like, just go to your nurse or doctor and tell them that the symptoms that you have, if you feel comfortable, talk to them about being choked. Talk to them about any other risk factors. Like, let them talk with you about the neurological symptoms that you experience. And even whether it's this or some other cause, they can help you figure out how to try to rehabilitate your brain and also try to figure out what the source was, because maybe it's from this, but maybe it's from some totally different health issue. So the important thing is to encourage them to start a conversation with healthcare providers, because what we found in some other research is that only about 1% of women who have experienced symptoms from being choked have ever talked with them with a healthcare provider. Can 7% of men. Usually we see a lot more women seeking healthcare than men, but not for choking. And when we ask them why, a big barrier for women and trans and non-binary folks is worry about feeling judged for their sexual behavior. So we also really want to educate clinicians about these behaviors, so that they can approach sex in really kink affirming ways, and just ways that affirm the broad range of sexual diversity that's out there. Now, this is an example that is from our own Indiana University Student Health Center website. It's a small things, but sometimes small things can make a big difference. We had this great doctor who said, I know that you've been doing research in this area. We have an area of our website that addresses sexual health. We want to add something on choking. I've written something. Can you take a look at it? Can you suggest some edits? Can you send it back? And I said, yes to all of that, right? And so I sent them some things back. We iterated and they came up with some great information. So they talk about the health issues. They talk about the effects on the brain that are well known from choking or strangulation. They, give people information that they can stop doing it, even if they've been doing it for a while. We also talk about how, there are other ways to explore that are less risky, and that if someone were to lose consciousness or have neck swelling, that they should seek medical attention right away. So that is where they landed in kind of incorporating this in their larger, section of their website. They also talk about assault and victim resources. So in summary, sexual choking has become mainstream and normative among young people. It's widely depicted in media. It's never zero risk. There's always some risk of injury or death, including silent and delayed health consequences, like on the brain, these cumulative health risks. And there's aspects of choking, like the being unable to breathe or speak, that complicate communication and consent. But also college students and other people really want to learn about choking, health, consent, and even legal consequences. So I think we should be able to engage with them. So this is a book that I wrote that came out about a year ago, where I include information for parents with talking with teens and college students and other young adults about choking and rough sex, including scripts that people can use with partners, if they want to say up front that they don't want to be that they don't want to choke someone or be choked, to try to head that off at the pass, rather than just possibly risking it just like happening to them in the middle of sex, like often happens. We've provided information and worked a bit with this group called In the Know in New Zealand. They have free online fact sheets, one about rough sex, one about choking, lots of other sexuality topics for young people too, and other topics. But these are two examples if you're looking for inspiration for ways to address rough sex and choking. They're a wonderful youth engaged organization. So they worked with youth, I think, from like ages 13 to 21 to really create these. They also have some videos from healthcare providers about choking and strangulation. They got the same feedback from youth, which is do not call this strangulation. I think the healthcare provider understandably does in the video, and the fact sheet is more uses terms like choking and rough sex that the young people felt were important to be used. This is another, just again, if you're looking for ideas and inspiration, this is just came out this past year. It's from a group in Australia. They have a campaign called It Left No Marks, which is about strangulation, which doesn't usually leave physical marks on the body, but again, has a lot of delayed and invisible health consequences. So generally, they have been focusing on partner violence, strangulation, but recognizing that choking has also become prevalent in Australia. There have been two or three studies out in Australia now on the topic. They created this, sort of community facing brochure. Where there's information specifically about sexual choking. So you can find partner violence resources there, and also now the sexual choking one, where they talk about the health risks and about consent, and answer questions about harm reduction as well. So again, there's multiple resources out there, and I cannot wait to see what you all create as well, because this is a very prevalent issue. and it's one that we simply have to engage in and that young people want us to. And so there's a lot of room to create materials that will be helpful to people. So thank you so much. I look forward to the conversation.
Thank you very, very much, Dr. Herbenick. Thank you for all of this information. I have at this time turned on cameras and the ability to unmute yourself. Feel free to add any kind of questions or raise your hand if you'd like to be bold and go off on mic. Um, I also just want to note that to point out the reason why the Office of Higher Ed is involved is that we have attainment goals and we are here to support students in completing their post-secondary credentials, whatever that might look like. And if there are barriers because of engaging in sexual choking, we want to make them aware and be aware of that, of the risks, and give them the resources. So we are working together to create some information on this to be shared to the institutions soon. So without further ado, we do have a couple of things in the chat as well. And please feel free to raise your hand and ask questions for the last few minutes here. Somebody asked, can you go back to the slide about the book you wrote? I didn't get a chance to write it down, Dr. Herbenick.
And then it looks like they got it. Yeah. So it's called Yes to Your Kid, What Parents Need to Know About Today's Teens and Sex. It's much broader than that. But I often joke, but it's true that I wrote an entire book just because I wanted to get one chapter out to parents about rough sex and choking. And I was pretty sure no parent, I'm a parent myself, was going to buy a book that's just like your kid in choking or something like that, right? But so it covers lots of other things. But thank you. Yeah.
Great. Other questions?
One
People, be
question.
brave.
Okay.
Oh, go ahead.
One question I get often, I will say, is like, can we really talk about this with teenagers? There may be people here that work with teens or have teen patients. And, again, like I would go back to like the data where we have most of the college students are saying middle school or high school. My own college students have said, if you wait till ninth grade, or sometimes they say 10th grade, it's too late. Right. And they've been saying that for years, but then when we see these data and we say, oh yeah, the average age of first learning about it being 15. So, and if your kid likes Jack Harlow, then they already know about choking. Like he's singing about it. If they watch The Idol, right? So if they like The Weeknd and Lily Rose Depp, I mean, their popular song has like a refrain in it that's like choke me till I pass out or something like that. So the thing is that is a real challenge that it is so pervasive in media, but it's also an opportunity for any of us who work with teenagers or young adults to say like, oh, like you hear the song, you know they watch the show. Like, have you heard of choking? Have you heard of rough sex? Like, what do people say about it? What have you heard? What do you think about this? Try again, like without judgment, to be addressing it. I see there's a question about harm reduction strategies. So this is sensitive and controversial. I'm going to put that out there, right? Not every it took me a couple years to get to a harm reduction space in this. A colleague asked me, who's a pediatrician, like, so what's your goal, right? Is it prevention? Is it harm reduction? And at first I said prevention. He was like, well, let me know when you get to harm reduction. He had been working with teens for 40 years, right? And that's kind of what a lot of pediatric folks have said. So, oh, and yes, choking continues into adulthood for people, for sure. We have high rates in the 30s now as well. But some people also stop when they hear about the health risks. So harm reduction strategies. These have not been tested. But here's what we do know is that just like in partner violence, people with sexual choking who are using ligatures report a lot more symptoms from being choked, like a greater impact on their body than using one hand. So at the least, we can tell people that like a ligature is probably higher risk than hands. Um, we have a good reason to believe, based on what we know from strangulation and also just neuroscience and brain health, that again, repetitive stressors are harder on the body. So if this is something that people decide to do, even knowing the risks, I tell my own students, I would make this a rarity in your life rather than something that you do every time that you have sex. We have some reason to believe, just based on my colleagues and who study brain health, to think that like that repetitive style is probably harder on the brain. So I also say, if you're going to do this, I mean, not that we don't want to say sustained pressure either, but again, like my recommendation is that you don't do this at all, right? Like for all these reasons. But if you do, this pulsing actually might be harder on your brain. You probably don't need to be choked 5 or 10 times during an event. So there are things like that. Certainly not using drugs or alcohol. The deaths that we've seen are very often using drugs and alcohol at the same time, right? So, and that's not to say that as long as there's no drugs and alcohol, it's risk-free. We know it's not. You can still possibly die, but a lot of the deaths that at least get media attention, again, there's no systematic reporting, but the ones that get media attention, often there have been some drugs or alcohol involved, which can make somebody a little bit, less responsive. And if the person doing the choking is using drugs or alcohol, it may be less clear to them when their partner needs help. So I think those are some starting places for thinking about harm reduction. But I am always clear with people that um, what the risks are, and that my first advice is not to do this and to remember that there are so many other ways to be sexual. Most of my college students say, um, if I had known these risks, I would never do this. Like there's so many other ways I can be submissive or dominant or play. Like, and I'm in a human sexuality class with them. So, right, we're talking about lots of diverse forms of sexual expression, and they get that. I have a small subset of students when I guest lecture or in my own class who say, yeah, I didn't know these things, but like I do, like I drive fast or I binge drink and I'm okay with these risks. And I want to know how to do it more safely, but I'm generally okay with some risks. So we can expect that there is some portion that's going to be the case for. And we do need to learn more about harm reduction. That's just kind of where we're at right now. Like no drugs, no alcohol. I'd stay away from ligatures if I were you. Low frequency, more gentle than aggressive.
Great. Thank you. Other questions? We have about a few minutes.
I'd also mention with the adulthood issue, like for people dealing with pregnant people, some I've had done some talks with OBGYNs, and they have said, like with anticipatory guidance, they say, yeah, I mean, I talk about not laying on your side during sleep, which is about getting oxygen to the fetus. I can also say, easily, like you might have heard of choking, like, hey, don't do this. It reduces oxygen to the fetus. So I think we all can enter this in different ways, but when we think about healthy pregnancies, that can also be a time to intervene and encourage folks not to do that.
Debbie, we have some post-secondary personnel who are Title IX coordinators and or campus safety, and curious about your thoughts about as a part of first response or reporting or responding to a report. Is this a question related to choking that should be asked and part of the regimen?
Yes, I mean it's extremely common. So I think asking about it, asking how it was done with one or two hands, ligature, arm or leg, but getting some detailed information about it, their perception of intensity, certainly any strangulation protocols you would normally follow from there, for example, types of responses to the body. So getting good strangulation related training anyway is important, but I would ask about this. And use words like choking or strangled, because we do know that not everyone would consider themselves to have been strangled, even if they considered themselves to be choked. And, related to Title IX, I think a real challenge that I know some universities I've heard from, they've thought about making even consensual choking kind of against the rules. Some countries have done that around the world now. And in Australia, there are states within Australia who have done that, and then they've also checked their students' awareness of the laws, and they're often not aware of the laws. So if anyone decides, right, to say at some point consensual choking is considered misconduct, we have to remember that this is so highly prevalent that the students are going to need a massive education program to understand that. But I mean, it's just right again, half of the college students are engaging in this. So I think that is kind of unlikely for many places. But one places I know some general counsel really challenged or feel challenged by are the lethality assessments, where they might say, traditionally we expelled people who have strangled people. We don't want to expel up to half our students, but at the same time, we don't want to normalize strangulation so that it's not a concern anymore. So I think one of the things we all need to figure out together is kind of what makes a strangulation a concerning level. Is probably a constellation of factors, right? Of other things the person might have said or did, or other things that really felt like more it was an intent to harm. But I don't have an answer to that. But I do know that universities are really, really struggling with that issue of what to do with lethality assessments now that this is so common. And it's absolutely the case, right? For those of you familiar with the research on strangulation and violence, that people who have been strangled are at a significantly higher risk of being killed by that partner at some point in the future. So there are really good reasons to take it seriously. Another issue which I didn't mention, but I think we're going to see more of, is there was a recent paper that just came out in the last month, um, and it looked at a fracture of what's called the hyoid bone. And it happens sometimes as part of strangulation, but there was a case where somebody was in a relationship that had abusive moments in it, right? But this person had also engaged in consensual choking and with the same partner. So when after they had their assault and they pressed charges against this person and they had injuries from the assault, it was contested whether the hyoid bone injury, for example, was from consensual choking or the non-consensual choking from the same partner. And I think we're going to continue to see that, because we may see people where they say, well, I have these injuries from the assault, and they say, well, you had been consensually choked by them from a few dozen times. Can you really say it was this one time? So that's a vulnerability point for again, especially women and trans and non-binary folks who are at greater risk for assault, as well as sexual minority men. And I think I know with my own students, hearing about that has also made them think, yeah, what why am I doing this, right? And what vulnerabilities am I possibly posing? So that is the first study it's a case report, right, that's come out to address this, but also something we really need to be thinking about.
Thank you. Thank you so much. We have a lot to think about and hopefully can ruminate on this and bring it back and continue the conversation. Thank you, Dr. Herbenick, so much for presenting today. And thank you so much all for attending. I will be providing a follow-up with an email. The recording will be processed for accessibility. And please take a little bit of time to fill out the survey on this session, as well as if you wish to have a certificate of attendance, I will be happy to provide that as well. So thank you, everyone, and have a wonderful day.